So the AAP guidelines, the preterm infants who need mechanical ventilation. So this is almost similar to the NNF guidelines. So we have to select the infants, so select the newborns who are intubated at the delivery room. So only those newborns born less than 28 weeks of gestation, no respiratory efforts, intubated at the delivery room, one can administer prophylactic surfactant. So similar guidelines to NNF is also declared by AAP. The European standard guidelines also same, prophylactic surfactant no role. Early rescue surfactant can be given if there is a clinical sign of RDS. If once you have started the CPAP, the newborn requires more than 6 centimeters or at least 6 centimeters of PEEP, and if the baby requires more than 30% of FiO2, then we can go for early rescue surfactant. Okay. So why these pressure and this PEEP and this much PEEP and this much FiO2 is needed? To maintain the SpO2 of more than 91%. You need to definitely remember these three values. Okay. So no role of prophylactic surfactant. Selective surfactant strategy is what is practiced nowadays. Delivery room CPAP stabilization is more important. Only then you have to talk about prophylactic surfactant only to particular that subgroup of infants that I told you. And our goal is to maintain the saturation more than 91%. If the pressure requirement, if the PEEP requirement, when you have started CPAP, if the PEEP requirement is 6 or more than 6 and the FiO2 requirement is more than 30, then okay, we can decide to administer the surfactant, right? Very simple points, but each and every point is important. Okay, so this is again from the NICU protocol of AIIMS. So this protocol also similar, whatever points we have discussed, but to look at it, we will have a better approach. So this is an algorithmic approach. Say you have a newborn delivered at less than 28 weeks of gestation, and if any one of the following is satisfied, say the gestation is less than 26 weeks or intubated at the delivery room or no or incomplete antenatal steroids, if any one of these three are followed, then we can administer the prophylactic surfactant. But after stabilization, start the nasal CPAP. Start the CPAP, do the surfactant prophylactically. Prophylactic surfactant means baby has not developed any clinical sign of RDS, right? Okay. So these three indications, this is from the AIIMS NICU protocols. Okay. Okay. So stabilized with the CPAP, administration of surfactant is done, and then if the baby has good spontaneous respiration, you extubate, you intubate, give the surfactant, extubate, which is called as the INSURE technique, right? This is what most of us are practicing still now, INSURE, and then extubate to nasal CPAP and stabilize the baby on nasal CPAP. When will we repeat? If there is an indication. So after around 4 to 6 hours, usually after 4 to 6 hours, the repeat dose of surfactant can be given. If there are indicators of CPAP failure, if the pressure is still high, that is 6 centimeters of PEEP, 40% FiO2, we can give a repeat dose of surfactant. So now that we have finished this arm of the flowchart, let's move on to newborns born more than 28 weeks or at 28 weeks of gestation. So this is about the prophylactic surfactant indications. Okay, so this is about the respiratory distress is at birth. So now that the clinical signs of RDS has already set in, how do you identify or how do you select? You know that this is a 28 weeker and you start at delivery room CPAP. If the pressure is high or if the FiO2 is 40% or more, then we decide to give the surfactant. If the newborn does not have spontaneous breathing efforts and you mechanically ventilate, you start mechanical ventilation, of course, then you can start giving the early rescue surfactant. If there is a good spontaneous breathing effort, continue on nasal CPAP. If no, continue on mechanical ventilation. Again, similarly, when do you start the second dose or when you repeat the second dose is similar. When there is a CPAP failure or when there is mechanical ventilation, still the pressures are high, FiO2 is 40% or more, then you repeat the surfactant dose. Please follow this, of course. This is very simple and practical. The previous guidelines I told you is all these flowcharts or all these algorithms have been derived from those guidelines. So that's why I was describing all those things.